All right, story time. Recently, one of my employees who just graduated nursing school and is studying for her NCLEX told me she keeps on getting pediatric developmental milestone questions wrong on her practice exams. She said, I always think of your kids as my baseline for what's normal developmentally, but then I get the answers wrong. The reason is because my children are hitting milestones on par with the old CDC standards. In 2022, the CDC officially changed those standards for the first time in decades. The issue is that instead of raising the bar to support earlier detection of delays, the standard was actually pushed back. Let's go through a few examples. Walking or a few steps, once expected by 12 months, now 15 months. First words, once by 12 months, now also 15 months. 50 words, previously expected around 24 months, now pushed back to 30 months. And 2-word phrases, previously were expected by the age of 2, now shifted to age 3. Notice the pattern here. Every major milestone was shifted later. What once was considered delayed now fits inside that normal zone. We even completely removed crawling from the US milestone list, which is not just a precursor to walking, it plays a critical role in neurological wiring. Crossbody crawling stimulates the bridge between brain hemispheres, supporting coordination and communication. It also builds midline crossing, proprioception, trunk strength, and hand-eye coordination. By dropping crawling, we risk losing visibility into a foundational stage of brain-body integration. The CDC says these revisions aren't about lowering quality. They change the benchmarks from the 50th percentile, i.e. when half of kids achieve the skill, to the 75th percentile, when most kids do. It sounds harmless, but there is a trade-off. Fewer children may be flagged for early delays, meaning missed windows for critical intervention. That new normal may elevate tolerance for subtle neurodevelopmental drift. And more kids can enter school with underdeveloped coordination, delayed language, and learning challenges that could have been caught earlier. Y'all, this is about the standards we're setting for an entire generation. If we normalize delays today, what happens 10 years from now? More kids will be entering school without language readiness. It will take longer to identify learning disorders, and we'll continue to have a healthcare system that reacts too late instead of preventing early. Instead of asking why so many children are delayed, we've simply just move the goalposts. As a practitioner and a mom, I want parents to hear this. If your gut tells you that your child is behind, please do not ignore it just because the chart now says it's normal. Trust your observations. These milestones should be tools for early detection and early support, not excuses to look the other way. Do not wait, ask questions, advocate early.